According to Oregon Health and Science University, evidence-based practice integrates the best available scientific evidence with the best available experiential, otherwise known as patient and practitioner evidence, considering internal and external influences on practice. This problem-solving approach to nursing has evolved and advanced as new scientific and medical discoveries, along with new technological advances, have come forth throughout history. Evidence-based nursing all started with Florence Nightingale in the 1800s. While it was not officially known by that name, she was the first nurse to use observations and solid evidence to improve patient outcomes. In her posting at the Barrack Hospital in Scutari, Turkey, she took note of the obvious unsanitary conditions and the effects it had on the patients there. She used her observations and knowledge to improve the quality of their care and nursing in general. According to an article in the Journal of Professional Nursing, utilizing nursing best practice guidelines, reviewing and implementing applicable research evidence, and taking advantage of technological advances are all ways in which nursing can move forward as a well-informed discipline. According to nursing.com, there are 3 different levels of evidence-based practice in nursing that grade the strength or quality of evidence generated from a research study or report. These 3 levels are classified by the letters A, B, and C, A being the strongest and C the weakest. Level A brings evidence in from randomized controlled trials, systematic review or meta-analysis, and clinical practice guidelines. Each of these form a process, one leading to the next. This builds the strongest evidence since each part comes together to form a more and more reliable claim backed with evidence. Level B contains evidence from well-designed controlled trials without randomization, a clinical cohort study, a case-controlled study, an uncontrolled study, an epidemiological study, or a qualitative or quantitative study. Each of these would be done separately and would be chosen by what would best fit the case being studied. The weakest evidence comes from consensus viewpoints, expert opinion, and meta-synthesis. The first 2 are used when there is an absence of any qualitative or quantitative studies. The other is a synthesis of findings from different studies, usually qualitative or quantitative. These options do not offer a very solid background to make a claim on. Evidence-based practice leads to improved patient care. This is truly significant that simply making a few policy changes based on evidence found can drastically improve the way we take care of patients. Even nurses who have been doing something a certain way for years and years might learn something new that contradicts what they have done. Because the new information is backed by solid evidence and testing, the procedure will be changed. Since the very early history of nursing, so much has been improved. One of the biggest things is infection control. We are always learning more about better ways to keep infection from spreading within a patient and between patients while they are in our care. An article in the Online Journal of Issues in Nursing states the modern impact of evidence-based nursing in a powerful way. The author says, "The impact of evidence-based practice has echoed across nursing practice, education, and science. The call for evidence-based quality improvement and healthcare transformation underscores the need for redesigning care that is effective, safe, and efficient. In line with multiple direction-setting recommendations from national experts, nurses have responded to launch initiatives that maximize the valuable contributions that nurses have made, can make, and will make to fully deliver on the promise of evidence-based practice."